Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. Hi, everybody. I'm Dr. Vonda Wright, your orthopedic surgeon and longevity doc, and thank you for coming back to Hot for Your Health, where I talk to innovators, movers and shakers, and just fascinating people about what's going on in their lives and health. And today, I am fangirling because I finally am getting to talk face-to-face with Dr. Betsy Grunch. You may know her from social media, where she has millions of followers from Instagram, YouTube, TikTok as Lady Spine Doc. But Dr. Grunch is a board-certified neurosurgeon. I know there are very few female neurosurgeons in the world, and Dr. Grunch is one of them. She is not only a great surgeon, but a key opinion leader within spine societies, a clear digital opinion leader talking about cases, her family, what it's like to manage a huge practice and just be a cool wakeboarding person. She's a mother of two. You're a wife. You're a daughter. Can I call you Betsy today?
Of course.
Of course. Betsy, what drives you? How do you do this? People are going to want to know.
Oh gosh! First, thanks for having me on. I am also fangirling. I love to talk to other women in our field because I feel like we have so much in common, and I'm just excited to talk to you today. But yeah, what drives me? I don't know. No, I like you know, we're just type A personalities, and I'm always on the go, and I just like get so excited about what I do with my job, my family, my personal life. I'm just always just want to be on the go and do stuff. And so I think that's just the way I'm driven and the way I'm hardwired. So yeah, it's been a fun journey for me to kind of share all of these things on social media. And I think we're going to talk about some of that today. So
we are. You know, I love that your answer is that, because what it sounds like to me that you just accept you're a high capacity person and don't try to, I mean, I didn't hear one apology in that, like, oh, I don't really do that much, which is sometimes what women do. You're a very high capacity person. You're using every inch of your capacity. And I love that answer. It's so authentic.
Yeah.
But one of the things that you post all the time is a case series of very interesting cases. It's almost like solving mysteries. What are the things within neurosurgery that excite you, that make you like, I'm on call, what am I going to get?
Yeah, I'm not on call now. But I mean, I just love my field so much. It's just something that drives me every day. I'm always excited to see patients. I mean, in all of our fields, we have our bread and butter, but like every case is unique and every case is different. And the way we approach patients and problem solving, and particularly with surgery and what I do, spine surgery, like, you know, everything can be personalized to the patient's problems. And it's just so fun to be able to talk to patients and to solve their pain journey, their problems with their neurological system, and unique ways that we can go about solving that, with it, if that's surgery or not surgery. So for me, I kind of started that case study. I was trying to think early on in my social media journey, like what's going to be my hallmark? What's going to be my the thing that everybody knows about me? And the one thing that I really wanted to kind of maintain on my platform was my educational side, and like what I could do to continue to educate. And so I like talking about cases. I was like, you know what? Every Sunday I want to make myself do a long educational video. And it's just kind of been like the one of the backbones of my platform, and one of the things that I really like doing. And people are like, aren't you going to run out of stuff to talk about? And I'm like, no way. I mean, there's so many things that we can talk about in neuro. And so, yeah, I think it's super fun. And I love, like I said, I love educating people. And I think it's really unique as doctors on social media with platforms like mine and yours of ways that we can explain the body to people that are in the public that don't understand. And, I think as doctors, we take for granted our knowledge and how much we understand about the body, and that the common layperson doesn't. And we can have our ability to really talk about that. And it's just, it's fun. So
it is fun. And what's interesting to me about what you said is I just wrongly assume sometimes that people know body part names, or people know where their hip is. For instance, I do a lot of hip arthroscopy. But why would they know that the hip joint is actually in the groin and not to the side, right? Why would they know that? So I love that. A part of my clinic visit is educating. I draw pictures for everybody. Do you do things like that? Do you use educational tools as you're teaching about the surgery you're about to do? How do you explain it in lay terms?
Absolutely. So I have a platform that I use in every patient video that allows me the ability to like record the visit first of all, so they can share it with their family members or whatever, whoever's not there, or rewatch it in case it's like kind of overwhelming. I always show patients their x-rays and spines and models to kind of explain what we're doing. And then I've also created for most of the procedures, I do some content, and I send that to, I like to make videos. So I send that to them as well so they can kind of digest what we're doing. And I agree. The mainstay of what we do in our practice as physicians is education, and the best ways that we can do that is kind of break it down on levels that they can understand and why they may or may not need certain things. So, yeah.
And so when you're teaching residents and fellows, how do you tell them to do this? Because I think, in the education system, they're drinking from a fire hose. They're just trying to assimilate thousands of pages and reams of textbooks. That's how old I am. We had textbooks instead of online books. But in fact, I still have some in my office here. But how do you tell them what you just said? It's the heart and soul of a doctor-patient relationship.
Yeah, I think as residents, we don't really get taught, or even in medical school, it's so hard to develop that trait, and we don't get taught how to do that. And in residency, you're right. I mean, you're just trying to consume the information and yourself, much less try to explain it to other people. So I think it's just like a trait that we kind of learn on the go, and we find our own ways of doing it as we grow as physicians. And so, I'm in a private practice, so I don't teach a lot of residents myself or have residents of my own or fellows, but I am in a hospital that has DME, so I do interact with younger residents and medical students. And, it's just about trying to break down concepts so you understand it, and then learning how to turn it around and relay it to patients in a similar way. And, so that's...
And don't you think that calms your patient down?
Oh, yeah. Oh, yeah. I think when they feel that you know what's going on and you relay this very calming, explanation, even if it's the most horrible diagnosis or whatever, if you stay calm and explain that, I mean, it calms them and lets them know you're in charge and that you got this. So important.
Not new to you.
Yeah.
It's not new to you, and you'll get them.
Right.
Well, I operated today, and more than the technical part of what I do, which I still love. I mean, I love the fact that I can see with my brain and make my hands make something 3D. I love that. But for me, is it for you? It's the human relationship side that makes me continue for as long as I've done it, and going to make you continue for another 20 years because, I don't know, maybe I'm assuming. But the technical part is not the reason I stay in.
Yeah.
Maybe it's for you. What are the reasons you stay in? Because it's hard. I've seen your call nights.
No, it's horrible. I dread call. I love it, but I hate it. It's just it's so hard, and it gets where I operate at a level 1 trauma center, and like those call nights are brutal. And when they're not, it's like a great, you feel like the skies have parted and heaven has rained down upon you. But yeah, I mean, no, definitely it's the relationship that you give to patients. And like I said, I love the problem solving aspect of it, and giving people solutions, and having them understand it. And that's what I really like about my job. I mean, the technical stuff is the technical stuff, and I love refining our craft and doing it better and doing it cooler ways and innovative technology. And that's fun too. But just teaching is something that has been really like kind of core to me. And that's, teaching patients, and teaching other surgeons, and teaching the public. So it's what keeps me driven. So.
Absolutely. And you know what? There is so much data that was just posted again within the group of people that I communicate with every single day. But it was just posted again that female surgeons and female doctors in general have better outcomes from surgery, less readmissions, less complications. And that's not to say that the 94% of orthopedics, which are men, born without the advantage of ovaries, as I like to say it, they're brilliant. I love the men I work with. But multiple studies have shown that there's something different with the way that women communicate, the way we listen, the way we explain, drawing all the procedures for my patients. And I value that. So what has changed in the last 11 years? Technology 11 years ago when you came out of fellowship is probably so different now. What are a few of the modern spine things that you've gotten to adopt post-training?
I think you touch on a key point, because as surgeons, no matter what your specialty is, things change like year to year, and there's so much new technological developments and stuff. And there's a lot of surgeons that just kind of stay with what they're trained on, and that's it. They don't learn anything new. They don't care to learn anything new. They do it their way. And, I had a couple of older partners that were in their 60s and 70s, and they were still doing it when they're retired. But they were still doing it the way they trained. And it's just like, we have to kind of continue that medical education to learn how to do new things and adopt new technology. So my favorite things in spine have been just doing, minimally invasive spine surgery has always been a passion of mine. But I never in training learned how to do endoscopic or ultra minimally invasive spine fusions and transcamen approaches, which is like the least invasive way of doing a spinal fusion. SI joint fusion for especially when it comes to women's health. Never did an SI fusion in my entire residency. Never learned about the SI joint, and it's such a critical part of my practice now. Disc replacement. Never did a disc replacement in residency, and that's where the future in spine is. And if those weren't things that I didn't learn on my own, I would have been behind the times. So I think it's important to continue to educate yourself. Ask questions, look in journals, go to conferences, and learn, and it keeps you excited and wanting to do more. So
and always curious, right? I mean, to give people context, when I trained, I was in residency from 1999 to 2004-05. I did a 6-year residency because I did a research year. But there was no micro spine surgery. We'd flip them over on the bed. Giant incisions, and it was great. It was great to see everything, but the recovery was so much longer. And what I love about the new techniques in spine, where you send them home really quickly, or in orthopedics where I'm doing surgery through needles now, is less narcotics, less pain, more function, rapid recovery, and still amazing outcomes.
Absolutely. Yeah. And the spine and joint surgery is the same. I mean, the more you destruct and pull off the muscle and sew it back together, I mean, you're kind of destroying the intrinsic components of what makes us move and our mechanics and stuff. And so open surgery is great for certain problems, but if we can maintain those muscular insertions on the spine and do it in less invasive ways, I feel like it really preserves the integrity of what is our core of our body. And it's so important in the recovery process in the long term. spine health.
Yeah, I totally agree. Now, we've been talking mostly about surgery, but the fact of the matter is people may not know this, but most really good surgeons, spine is a little different than sports medicine because you have a mature practice, you have a tertiary practice, people are sending people to you. But on average, only 2 out of 10 people actually have to go to the OR because there's lots of conservative management, lots of therapy, injections, pain management, things to do in both of our fields. So just for the audience, I want you to give people some concrete ways, the Dr. Betsy ways when people come to you to get rid of the scourge of low back pain. It's endemic it's pandemic in this country. If you were going to have people say, okay, here's my 4 things, just help us out here, because everybody has it. It's not shooting down your leg. It's that you can't sit there. It hurts too much, or you bend forward and something gives.
Yeah, it's spine. I mean, the facts are like more 95% of Americans will have back pain at some point in their life. We accept it as common. We accept it as like normal, but it's not normal to be in pain. And so, I've learned over my career, like things that people do that make them 60 years old and have this chronic back pain or have had, 5 or 6 back surgeries. Like what could they have done differently to make their lives better? And those are some of the things that I've integrated in I know you want to talk a little bit about my fitness journey in a little bit, but those are things that I've learned on how we can do it. So 4 things. Number 1, no nicotine products. Nicotine is horrible.
Terrible in all forms, right?
Yes. Gum, vape, chewing, Zen pouches, whatever the form may be, cigarettes, cigars, dip. Yes.
Yeah.
All of the things, nicotine is so toxic. And I think in medicine, we just talk about it being bad for the lungs and cigarettes, and it's not. It's really just the nicotine and vasoconstriction and impairing our body's natural ability to heal ourselves. So number 1 thing is no nicotine. Number 2 is maintaining a normal body weight. And the same goes in orthopedics, the more stresses we put on our joints and our backs and our necks, our hips, our knees, it's going to wear out faster. And I think it's just something that we take for granted. And in Americanized culture, we have all of these accessible foods and stuff like this. And we glamorize enjoying foods and things that make us happy. And not that that's a bad thing, but it has to come in moderation. And I think, really focusing on maintaining a body health, a normal body weight is so important. And on the same line, like what we eat is who we are. So that would be my number 3, is just maintaining a good, healthy diet. And I think we eat a lot of inflammatory foods and processed foods and in our culture. And it's just, it keeps this constant state of inflammation in our bodies and our joints. It gives us pain. And I've talked to a lot of patients about it. I try not to be like super, hippie about it, but it's true. I mean, like if you really understand your body and what really sets off pain, a lot of things are just simple things in our diet that we can make small modifications to make us better. And lastly is just exercise. I think so many of us just don't move our bodies. We don't stretch. We don't go out and take a run, do some cardio, lift weights. And particularly women, like we just get, we don't stay active enough, and we lose our core through pregnancy and at postpartum. We, lose all our abdominal strength, and we don't regain it back, and we don't stay active. And then over time, it just has wear and tear on your back. Your body has no support. You get osteopenia because you're not lifting weights. You're not eating enough calcium. And then, then boom, you're 65 years old with osteoporosis and degenerative disc disease. And you want to know, how did I get there? So yeah, those are my 4.
I love those. I'm going to put them up when I post that this is being released next week. You know what? I do want to hit back on what you just said about osteoporosis. I talk about bones a lot. And sometimes I come out of surgery and I'm just so compelled to say to the public, oh my God, her bones were like butter.
Yes.
I don't think people realize I could stick my finger through. It's the same with the spine. Spine
Yes.
fractures. I mean, it's spine fractures and femoral neck fractures that women suffer from osteoporosis.
Yeah, it's so bad. And, and I have had patients even like turn around on their seat to get the mail, cough and have a compression fracture. And once you have one vertebral compression fracture, you're 10 times more likely to get another one. And this is, again, a constant spiraling deconditioning process that happens in these women. And it's so frustrating because once the process is started, it's almost just like a domino effect, and it's so hard to reverse it. And it goes back to, educating weight bearing when you're young, not smoking, and taking your vitamins and eating good, healthy diet that makes your bones strong. And it's so unfortunate because it's such a preventable problem. And I know you probably the same way because I've listened to some of the stuff that you talk about. But it's super frustrating being this physician that educates on bones and no one else wants to talk about it or scan or do a DEXA scan. It's like, man, if I would have catch you when your T-score was minus 2.4, we could have done something about it. Now it's minus 4.1 and we're trying to chase our tails. It's like, man, so I just think it's such an underlooked problem, bone health, and it's unfortunate.
So how young should we start? People ask me this all the time. How young? I'm on this new campaign. I've got this thing going called 40-ish. It's time to get your proverbial shit together, an adult, right? Fun times are, I have 35-year-old children, so I could, so I'm like, okay, guys, you've had your fun. Let's get your DEXA scan. Let's draw your baseline testosterone for my boys to see what they are. But what age do you think people should start caring about their spine?
I mean, in their 20s, they should start caring about their spine, but their bones and stuff. I mean, I really think, I know the guidelines are a little different, but like in their, especially people with the risk factors like hormone replacement treatment, nicotine use, history of osteoporosis in their family, weights, ethnicity, should really get screened really early to know what they're up against and how to treat it. I mean, I've had women in their I check a bone density on every single fusion. So if I am instrumenting the spine in any way, disc replacement, screws of any sort, I check a DEXA. And and it's so surprising. I mean, I've had women in their 30s that have osteoporosis, and it's like, holy cow, like I never would have known. So I just think it's so important that and it's something that we don't talk about a lot about in medicine, but it really will affect how I can treat you if your bones are bad. I often tell women, and I say women because it is mostly women, but I can't even operate on you because I know I'll make you worse.
Nothing will stick. The pedicle screws will cut out.
Yep.
Right?
Yep.
Yeah. And all they want to be is out of pain. So, okay, your 4 points are well taken. So let's do a little bit of pivot from our work and to our lives, right? People are fascinated by how women surgeons keep it together. And I get that. If I'm fascinated by you and everything we're managed to accomplish. We'll talk about your time management because some days I just feel like I'm holding on, like today. I'm just holding on today. But you took firm control of your physical health some time ago. And if you scroll back in your social media long enough, you'll see a progression of you should do a flip book, like pictures from day one, showing everything you did to what you're doing today. You just got some new plates in your gym. It looks like really fast.
Yep.
So tell us, and I want to start with when you recognized that you were worth taking care of yourself, and then how did you do it?
That's such a good point. I think as doctors in training and as physicians, I think that we don't get education on our nutrition. And how that works. And people assume, oh, you're a doctor, you'll know how to lose weight. And that's not true. I went and also I won't even go off on my tangent on the toxicity of healthcare and how we're trained as physicians. But I was always kind of the chunky girl, never a skinny girl. I was always athletic, always like working out, but fat and happy. And nothing's wrong with that. But, when I got into college, I gained the freshman 50 pounds, and then it just kind of continued to spiral. The more I poured into my work, the more I used food as an outlet and a stress relief. And that continued in medical school, and it continued in residency, and actually accelerated significantly in residency because I used it as a stress coping mechanism. And so, and then you combine that with no time and then no exercise, and, you know, there you go. So, put myself in a situation to where, you know, I just never really put myself first. I put my patients and my education first, but my health last. And I didn't really think about it. Came into practice the first couple of years in practice, you know, and then I wanted to have a baby. And my husband one day said, I really want you to get healthy before you have a baby. And I'm like, wow, we never.
That's old.
It is. And we never talk about that, just for disclosure. Like he is so supportive and so loving, and does not care about me, does not care when I was heavy, because we met when I was very, you know, not skinny. And anyway, so when he told me that, I'm like, wow, like this may be I can't believe he said that, but it was kind of almost like this aha moment, like he's right. Like, so I was like, well, you know, I'll get through this pregnancy and then I'll do it. So that's what happened. I had my son, and right before I delivered him, I was 260 pounds. Of course, we're and pregnant. I was started at 220, but 260 pounds on my bones, my knees. I couldn't walk. It was
you felt
horrible. Yeah, and so
great.
I don't know. I have no idea. And then you add 25 pounds of lead on top of that every single day.
God. Yes.
And yeah, so, you know, when I had Riley in 2015, I 3 months postpartum, no core strength after a C-section, bent over to wipe the bassinet down and herniated a disc in my back. So
first nightmare.
Yes.
Because you knew.
I knew. As soon as it happened, I knew. And I was like, this can't be happening to me. I'm 35 years old. Like, so I really had a moment that was really my true aha moment, was that. And it made me realize that I might be the same patients that I treat every single day if I don't take control. Yeah. So then I started educating myself on how to go about doing that, because I didn't know how. So I started exercising and read about different things, and then ended up tripping down the stairs and breaking my ankle. And this is 2017, I think, and went through ORIF of my ankle. I was carrying my son at the time, and like I tripped over my dog is how it happened. And anyway, so I had this non-union because I was not compliant, because I was operating too much. And so fast forward like a year of my life, kind of undid all this health stuff that I had been initiating. And then I got pregnant with my daughter because I knew I wanted another child. And so anyway, after the birth of her is really when I took the reins in 2018 and decided to change everything and educate myself on diet and exercise and all the things. And so I, you know, read a couple of books. I read about intermittent fasting, which I think is a really, Jen Stevens wrote this really good book on intermittent fasting, and then The Obesity Code, which I think is a really, really good read. And those two books really changed my life.
Obesity Code is by Gunter?
Jason Fung.
Oh, Jason Fung. Oh.
I think so. I think that's correct.
Yeah. Okay.
Yeah. And so I educated myself on diet and started, you know, changing my diet and trying to understand that and exercising more. No, I really survived the first few times on intermittent fasting. So I just had a window that I ate. And I would, in hindsight, now knowing what I know about health, that really wasn't what I was supposed to be doing, but it worked. I lost some weight, and, you know, and then I got, you know, into this just funk where I kind of plateaued like we all do in this phase, but I'd intermittent fasted for like 4 years and had some good success with it. And then I was in this dance competition last year, and I just could not get the weight off. I had like 20, 30 more pounds I wanted to do. And I talked to my doctor about GLP-1 medication, and I could scream from the rooftops of how much I think this is really going to change a lot of people's lives. And it did change my life. It was, I used Monjaro, and it really helped me just get that extra weight off. But I found... What is that?
What? I'll tell you what people tell me, but what did it make you feel like? I'll tell you what people tell me, and you'll say, that's me or that's not me. people like you that I take care of who are motivated, they know what they want, they're trying their hardest. They tell me that when they start a GLP-1 inhibitor, what it does, it turns off the food buzz and it's easier. Is that what happens?
100%.
Yeah.
And it's crazy how it works. And you don't get it until you take this medicine. And I mentioned earlier that, food has always been my coping mechanism. And there's always these comfort foods. Like for me, it was peanut butter. I loved peanut butter. I loved certain things. And, I would just get some kind of satisfaction out of that. And it took all that away. So all that background noise about wanting to eat or when's the next meal or what am I going to have for dinner? Oh, I really am craving this.
Yeah.
Those just gone. And it's weird. And it changed my relationship with food so much that food became more of a source of nutrition and not like a desire.
Yeah.
And really, so it really changed my thoughts on food. And then in the past, 6 months, I found myself becoming more and more like almost anorexic. I was just starving myself because I didn't care about food. And
people said that to me. They're like, now I have to force the calories and the protein in. When did you start throwing weight around? Because I see you doing it. And
yeah,
something that I, push on people aggressively.
yeah.
But when did you?
Yeah, weightlifting is so important. And I was doing it when I was in that weight loss period before I started the GLP-1. I was doing it. And then when I started the Mounjaro, I was losing weight without trying. And so I stopped, I reduced the amount of physical exertion that I did because why? I didn't need to. I was losing weight. And then I found myself me and my husband and I were traveling somewhere and I tried to lift my suitcase into the overhead compartment on the airplane and I couldn't lift it. And I was like, this is out of control. So I caught up with another female physician who's super into weightlifting that I follow on Instagram. And I was like, I need your help. And so she and I came up with a game plan. She really taught me a lot about macros. Making sure your caloric intake, certain amount of protein, certain amount of fats, certain carbs, and when to take carbs and lifting. And so she developed this whole workout plan for me that I've been doing. And I've seen myself transform even in the past 2 months on this. And so it's been a journey for me that's really, and I think my followers have seen that. But I love, talking about it because we all struggle. And we all try to find our ways. And it's important to understand what works best for us and how we can become better because of all the things we struggle with.
Well, I've loved watching you do it. I really have. Because I think I discovered you a few months before your dance contest. And since that time. And I've seen you do all the things you're describing. And you're doing it for yourself. But the fact that and your children and your whole family. But the fact that you're willing to share it and that for me, when I post me lifting, it's not pretty, Betsy. It's not pretty, but we're just getting it done, throwing the plates around. I think it helps so many people because they're like, oh, those busy people can do it.
Absolutely. Absolutely. And I don't know about you, but I struggle with time to do it. I do it. Sometimes I do it in the morning, sometimes I do it in the evening. And then it's just, it's tough.
It is tough. I totally. And if I'm truthful with you, I'm always truthful about my struggles with this. There are very few days at all. And I think people need to know this. Very few days when I get to the gym by willpower. I get there by discipline because there's not one cell in my body after a long day that wants to go haul plates around or even walk with my weighted vest. Or the other day I had no desire. I just walked home. It's 2.5 miles from my clinic, but at least I did it, right? So I don't know about you, but it's pure discipline, which is something I've got from my years of training. Because it's not willpower. Willpower will fail you,
Absolutely. Consistency, scheduling, and just getting it done. And none of us want to. Sometimes I do. I'm like, I want to go work out, but usually like, I don't want to go to that. I want to rest. I had a long day.
Yeah. Well, I love that. Well, what is coming up that you're looking forward to?
I just look forward to just continuing to grow as a person and learning from all aspects of this journey for me, and getting to talk to people like you and interact with this amazing community of people that we have. And yeah, it's just, you never know what's behind the next door, and just enjoying the ride, man.
I love it. I can't wait to continue to watch your success and to watch your children grow. And I don't want to keep you forever. It's late and we both worked all day, but I love how whatever it takes, you carve out time to include Bea and Riley into your life. You take them to meetings. I took my youngest daughter to meetings from the time she was 3 weeks old. She could sit in a boring lecture like nobody's business, because we trained them that way, right? Because it was the only way we were going to see them. So I just wanted to let you know, I love watching you raise these children, and what amazing little people they are.
They're so fun. I mean, kids are just, their mind is so amazing at how they think and process things, and as they age. And I know that's kind of controversial, people sharing their children and on social media, and I've always thought about that. And I just think it's important, not using my children as an example, but I love them so much, and I want, most importantly, other women to know that they can do this and spend time with their kids. And that was something that I struggled with, wanting to become a physician. When I started residency, I was single. I was like, I want kids, but I don't know if I'll ever be able to have kids. And if I had someone like, that I could look up to and watch and say that think that it would be possible, that's one of my biggest reasons for integrating my family into my socials, is because I think it's so important to bring more women into our fields, like ortho, like neuro, that are severely lacking in women, because we bring a different mindset to the table, and not in a good way or not in a bad way. It's just different. We think about things differently, and representation in medicine in all fields is so important. And I just want to encourage more women to do what we do, because it's possible. You show it, I show it, and it's important.
You know what, Betsy, I believe, and you're an example of this, I'm an example. I really do believe that women can do all things. I sometimes can't do them all at the same time.
Yeah.
But I get to do all things. I don't have to choose. And so, anyway. Well, I've loved having you here. I'm so sad that I didn't meet you when I was in Atlanta, but hopefully our paths will cross.
Oh, it will cross. Absolutely.
Well, thank you for joining me. We're both up late after long days. Thanks for being on Hot for Your Health, and I'll talk to you soon.
Thank you so much for having me. It was fun talking to you, and I hope you have a good rest of your evening.
Thanks. Bye.
Bye.
I'm Dr. Vonda Wright. See you next week.